Welcome back to the show. It's been a week.
It's always been a week. That's the job.
Fair. So let's get into it. First up, North Korea is now officially in the healthcare ransomware business.
Yeah, state-backed actors linked to Medusa ransomware attacks on U.S. healthcare organizations and nonprofits, because apparently nothing is off limits.
For folks who haven't tracked Medusa, this is ransomware as a service. So you've got core developers building the malware, and then affiliates actually running the attacks.
Right, it's franchise crime. And they're doing double extortion. Encrypt your data, threaten to leak it. Pay twice or lose everything.
And the North Korea connection changes the calculus here, doesn't it?
It does. You're not just dealing with opportunistic criminals. You're dealing with a nation-state that needs hard currency. They're motivated, they're persistent, and they're not negotiating in good faith.
So what's the takeaway for our listeners?
Assume you're a target, segment your networks, test your backups, actually test them, and have a response plan that doesn't start with, I guess we'll figure it out.
Solid. Okay, shifting gears. The Senate held a hearing on health data and AI. Title was Transforming Healthcare with Data.
I saw that. Lots of talk about data liquidity, patients accessing their records in seconds instead of days.
Which sounds great in theory.
It is great, in theory. But every time you make data more liquid, you also make it more spillable.
That's not a word.
It is now. Look, interoperability is important. Patients deserve access. But we can't pretend that opening up data flows doesn't create new attack surfaces.
So it's a balance.
It's always a balance. The takeaway here? If your organization is moving toward more data sharing, and you probably are, security has to be part of the architecture, not an afterthought.
Next story. North Central Behavioral Health Systems in Illinois. Email breach. Unauthorized access to an employee email account.
Behavioral health. So we're talking sensitive mental health records.
Exactly. And this keeps happening. Email is still the #1 entry point.
Because it works. Phishing works. Credential theft works. And most organizations still treat email security like it's 2012.
The newsletter made a point I liked. Email is the single largest cybersecurity vulnerability in healthcare.
It's not glamorous. It's not a 0-day. It's just someone clicked something they shouldn't have, or reused a password, or didn't have MFA.
Takeaway?
Lockdown email, phishing-resistant MFA, encryption, training that doesn't put people to sleep. It's not rocket science. It's discipline.
And then we've got the College of Healthcare Professions in Texas. Data breach affecting over 68,000 people.
Potentially exposed PII and medical data. The details are still coming out, but that's a significant number.
And it's a reminder that it's not just hospitals. Educational institutions in healthcare are targets too.
Anyone holding sensitive data is a target, period. Doesn't matter if you're a major health system or a training program. If you've got records, someone wants them.
So, as we wrap up, what's the thread connecting these stories?
It's not bad luck. It's not sophisticated nation-state magic, though that's part of it. It's misconfigurations, blind spots, email accounts without proper controls, systems that weren't built with security in mind.
And most of it is fixable.
That's the thing. These aren't unsolvable problems. Patch your systems, secure your email, know where your data lives, train your people. It's work, but it's doable work.
All right, that's our show for this week. Thanks for listening, everyone.
Stay safe out there, or at least stay patched.
We'll see you next time.